The sensors, timed to your pulse, trigger the cuffs around your legs to inflate and deflate in sequence. The inflation of the cuffs squeezes blood from your legs, pumping it back to fill your heart. The cuffs become an external pump, assisting your heart. Enhanced External Counterpulsation Therapy, EECP.
It took about midway through the 7 weeks, and I started noticing a difference then. Just how I was feeling in general, the pain level, everything was slowly getting better.
Okay, but how does EECP therapy actually help? In medical terms, what's the mechanism of action?
EECP may in fact serve to alter the properties of the blood vessels themselves and make it easier for the heart to pump blood and for the blood to flow through the vessels to the body.
I'm really convinced the blood flow to the heart muscle is improved. The efficiency of the heart muscle is improved.
And what this does is it makes it easier for the blood to be pumped through the body and take some of the work off the heart, may expand the arteries of the heart so more blood can go to the heart.
So this relief of chest pain is presumably not just sweeping the pain under the rug, so to speak, the equivalent of giving an analgesic, but it represents a beneficial effect upon the heart and its blood flow.
Most of my patients who we're doing this on have angina and left ventricular dysfunction, so they don't have normal heart function. So it works in those patients, and I don't see any reason why it shouldn't work in people whose main symptom is heart failure.
I've treated a lot of patients with heart failure with EECP. They generally tolerate the treatment well. Not only do their anginal symptoms improve, but also their heart failure symptoms.
It seems the benefit from EECP treatment results from having all that blood quickly and vigorously return to your heart. Researchers think this forceful reperfusion produces the same effect as brisk exercise.
EECP may be like exercise training for people who can't exercise.
And that passive exercise, again, takes them to another level in which they can maintain an exercise program.
They'll start to be able to do more before getting chest discomfort.
In about 5, 6, 7 treatments, I noticed I wasn't as short of breath, I could do more, and it just got better.
They may even have their chest discomfort totally eliminated.
The effects after EECP varies. Some patients will have a very good durable response that will last 2, 3, 4 years or more.
In general, our experience is that majority of patients, overwhelming majority, don't need a second therapy.
If I need it again, without hesitation, I'll do it again.
About 15 to 20% of patients who've had a good response to EECP will undergo repeat treatment at about a year. And when they undergo repeat treatment, they also get a very good symptomatic response in terms of reduction in the severity of chest pain.
And with the same low incidence of side effects.
Vasomedical's EECP therapy gives you a head start on becoming active again. And the more active you are, the more active you can continue to be. EECP therapy sets in motion a spiral, an upward spiral towards better health.
The fact that you can exercise tends to help sustain the benefits. It also is true that it enables you to be more self-realized in terms of doing what you need to do in your life, whether it be caring for your family or carrying on a job.
The doctor's job is to make patients feel better. And I think we do in 75% of the patients we try this on.
It's almost been 4 years since I had it done, and I don't see any reason I would need it for another 5, 10 years, hopefully.
And these are patients who are resistant to a lot of therapy beforehand.
Now after my last session, I can do all the things that I didn't know if I was ever going to be able to do again.
I couldn't cut the grass. Now I cut the grass with no problem.
Last September, we made a 12-day trip to China. Now I'm 83 years old. I think I'm more active than most of my peers.
All the little things that you take for granted, you just get them all back.
I still carry nitro in my pocket, but I think it's just a security blanket.
To me, it's just a best kept secret in the world. When, it's such a wonderful thing and it's available.
I've told other people about it and encouraged them to check into it.
I've told doctors about it, and they have no idea what it's all about and how successful it is.
They gave away the free t-shirt, I'd wear it all the time.
I told you I'd give it to you straight. Vasomedical's EECP therapy changed my life. I sincerely hope it's the answer for you too.
Everything worked out so great. Still can't believe it happened.
Every day is a gift.
Talk to your physician or healthcare provider about Vasomedical's EECP therapy to see if it's right for you.